My name is Josh Carter. I'm a board-certified, fellowship-trained hip and knee surgeon here at the Midwest Center for Joint Replacement. And orthopedics is great. I love the field. And if you think about a calling, I feel like this matches me with my interests and passions. It takes people from being incapacitated and puts them back on their feet. We will treat them as an individual, and there's a unique approach to each person. Personalized care means paying attention to that person's unique anatomy, their unique problem, and that comes through in how we do the operation, how we speak to them in clinic. We pride ourselves on getting patients seen quickly. We have same-week appointments. I think it's really important. People don't want to wait when they're in pain. That also means access. They can call our office and speak with a human and not have to go through a long phone tree. It's easy to get in touch with surgeons and PAs directly. When a patient comes into our office, there's a different feel to it. And I think they feel loved and cared for, not just as a number on a chart, but as a person with a story. What they're getting back to, whether they're getting back to their job in a construction yard or at a law firm, or maybe they just want to be able to go to their kid's soccer game and climb the bleachers. And so we think that building that priority into the staff culture is critical for our practice. When patients get their quality of life back, it is so rewarding. I love it. I love seeing their big smile coming back into clinic, hugs and high fives. Doc, I was able to, get to my grandkids' play. I was able to do all the things that I haven't been able to, and it's just so rewarding to see that.